Sophia, just wondering, what are the symptoms associated with long COVID? Like, what kind of things we need to pay attention to?
That's a really important question, Rose, and something that we need to give a lot of consideration to. There are psychological mechanisms that have been implicated in long COVID, both in terms of the actual symptoms themselves, the psychological distress and symptoms of long COVID, but also we know that psychology and psychological mechanisms also can play a role as a risk factor for long COVID. So it's really good to actually unpack that a little bit here with Magdalena. Some of the symptoms that we hear patients self-reporting with long COVID, we're talking, for example, about increased levels of tiredness and fatigue. That's a very, very common symptom that we hear our patients talking about. Poor sleep quality and sleep disturbance. People often having difficulty either falling asleep or they're waking early or they're waking through the night and having difficulty falling back to sleep is another really common disturbance. We hear our patients talk about increased levels of depression, difficulties with concentration, thinking, cognitive impairment. Sometimes people talk about brain fog when they refer to that cognitive impairment. Anxiety as well is a really common one. So we often see changes in these symptoms over time, especially I would say depression and loneliness and even a decrease in life satisfaction. They're some of the symptoms that we see. People can often talk about changes, experiencing changes over time, and sometimes a worsening of those symptoms over time. And what's really interesting is that sometimes for some people they can have one or two symptoms. Sometimes there can be more than one or two, and sometimes the symptoms can be mild or moderate, or sometimes they can be severe and impact on the person's ability to undertake work, to undertake their caregiving responsibilities, and just to lead a normal life. So there is a wide range of symptoms, a diverse range of symptoms that can affect different people in different ways. And we also see that sometimes those long-term effects can occur, even in those who've had severe symptoms of COVID, but sometimes that's not the case. You can see long-term psychological effects in those that have had mild symptoms of COVID. So there certainly is an important cognitive, psychological manifestation of long COVID that we need to better understand and support those that are experiencing that. But the other thing I want to comment on is the psychology can also play a key role as a risk factor for long COVID. So the kinds of thinking that one is experiencing around long COVID can play a role. So, for example, if people perceive that the severity of symptoms or that the symptoms are going to be severe, that will affect how they experience long COVID, or their thoughts around their ability to fight the infection can impact on the length and the severity of the symptoms. If they've had, so the assumptions that we all carry around the symptoms of long COVID and the psychology behind that can play a role too in the risk. Those assumptions can play a big part, can be a big risk factor for long COVID. Even sometimes if we've had negative experiences with medical health professionals, with family, friends, employers, even sometimes the perceived stigma that we might feel that we've experienced with long COVID or with COVID can play a role in the symptoms and how they present. So we certainly know that there is a big psychological mechanism to one's experience of long COVID that we're trying to better understand.